A turning point in the battle against COVID-19 as the first round of vaccinations in the United States begin. After witnessing the suffering and deaths of COVID-19 patients, ICU nurse Sandra Lindsay didn't hesitate to be the first in line.
I hope this marks the beginning to the end of a very painful time in our history.
The vaccines come at a critical time as the U.S. passes 300,000 COVID-19 related deaths. The pandemic continues to overwhelm hospitals and devastate the nation's economy. But with the first shipments of the recently approved Pfizer vaccine arriving at 636 sites across the U.S. and a second vaccine slated for FDA approval later this week, Health and Human Services Secretary Alex Azar says hope is on the way.
As we speak, vaccine is arriving at sites and in trucks and planes owned by UPS and FedEx to bring these life-saving products to the places where Americans will receive them. This weekend's shipment of vaccines is 2.9 million doses, enough to vaccinate 2.9 million people.
Starting off the mass immunization campaign are those considered at highest risk, such as healthcare workers and nursing home residents. Vaccinations for the general public are not expected to be available until late spring 2021. Enough time, experts hope, to persuade the skeptics.
The existence of the vaccine alone does not end a pandemic. What you need a population willing to accept the vaccine.
The pandemic's devastating reach goes well beyond the U.S. population, hence a need for a multilateral approach to ending it, says infectious disease expert Dr. Bill Petrie.
We're not going to control this unless we have all the countries in the world vaccinated. Otherwise, we're just going to have continued outbreaks, continued problems.
Several countries, including the United Kingdom and Canada, also have authorized the Pfizer vaccine. And the World Health Organization reports there are more than 50 COVID-19 vaccines in human trials around the globe. Each vaccine, experts say, would be welcomed in the race to end this pandemic one needle at a time. Jay-Sue-Seh-Meh, VOA News, Washington.